to the George Brown College WAVE Clinic. My name's Maria. I've been expecting you. Come on in.
The PSW was Mr. Sharma today.
That's great. We're going to have Mr. Sharma sit right down in the dental chair.
The PSW student Sandy feels that she and Mr. Sharma have learnt some information about why the dentures has caused gum problems. Sandy stated that Maria, the dental hygienist at the WAVE Clinic, has provided lots of details about how to clean Mr. Sharma's denture that helps her to understand how to assist her patient in the future. Sandy feels it was a very good experience at the WAVE Clinic. As a PSW student, Sandy thinks she should have described more about Mr. Sharma's gum problems, such as which part of the gum was bothering him, or what type of pain Mr. Sharma was having. By doing this, Sandy thinks that Maria would be able to problem shoot and provide better direction. Maria went over both full and partial dentures, and if Sandy had provided a better description, Maria maybe would have only talked about the type of dentures Mr. Sharma has, and it would be less information for both of them to hear and learn. As well, this observation that Sandy has made can be linked back to the goals of interprofessional education and interprofessional collaboration. Sandy has also noticed that she was helping Maria put the bib on Mr. Sharma and wonders maybe that was not necessary to do. Although Sandy has learned about interprofessional collaboration, she's not sure that this type of helping is considered to be interprofessional care, or if this is something that she should have done. Since interprofessional education and collaboration is discussed in the PSW classes, this is one area that can be explored further in the debriefing session that follows the simulation. As well, the debriefer will need to inquire about what each of the participants and observers noticed regarding the interaction between the dental hygienist, PSW, and the patient. Neither the PSW nor dental hygienist have included the patient in their interaction or their teaching. Sandy also wants to make sure Mr. Sharma understands what Maria is teaching and that she is not the only one who understands. The debriefing could also discuss this concern that Sandy has depending on the amount of time available for debriefing, ensuring it links to the overall objectives, in this case, interprofessional education and interprofessional collaboration. You'll notice that Sandy coughed into her arm during the dental visit. She's aware that she must follow infection control guidelines and needs to wash her hands, but is unsure how to do this without disrupting the teaching. Sandy is not sure if she should ask the hygienist to allow her to wash her hands in the sink in the room or show her to another sink. This particular point can be discussed in the debriefing and be related back to the interprofessional care, interprofessional education goals.
I was so nervous. This was my first clinic where I would have to give detailed information on denture care. I had so many items as part of my demonstration that I placed them on the back counter. I can see now that this probably was not the best decision as I was constantly turning away from my clients. Next time, I will try and place all the items on my front delivery tray, and I will sit down and teach more effectively. We talked a lot in class about interprofessional care, yet I see that both Sandy and I ignored the patient. Finally, I need to make sure that my clients are learning what I'm teaching by having them demo back some of the skills. I also need to check with them from time to time to see if they have any questions. Practice makes perfect.
As a patient, I guess that I'm a little anxious and nervous and excited about my visit to the dental clinic. I know that I'm in good hands and that the PSW and the dental hygienist will take care of my denture and gum problems. I want to understand what Maria is teaching Sandy. As Maria said, it's important for me to understand what's happening so that I have the knowledge about how to take care of my dentures. Maria has taught Sandy a lot of procedures. Although she has used simple language and given lots of reasons for the do's and don'ts, I feel that as a patient, I may not be able to understand and remember everything on my own. This is where I'm glad that Sandy, my PSW, will help me figure out something if I forget it. As a patient, I would have liked for them to have involved me more actively. However, as the time for the visit was very short, I think that they were concentrating on transferring the knowledge from one professional to the other. I felt a little left out, but in the end, I think that this was unintentional. I did not mind it at all.